the big story, which is truly a shared experience of all of us around the globe. Not in the last 100 years have you had a situation which applies equally to everyone around the world, no matter what they were going through at that point. And that's what we have seen with the COVID-19 pandemic. It has changed so many things in the way we view the world, in the way we function. Hybrid work from home and hybrid offices have become the norm. In India, it has sped up our move towards a digital economy. E-commerce got a spurt like never before. EdTech got a spurt like never before. It also, in a sense, was worse for the weak and better for the strong. Those who are weaker, the weaker segments of society, have suffered more than ever before and are still struggling after a 2-year pandemic. Meanwhile, businesses which were poised for acceleration took a quantum jump. The question now is what comes next? To speak on the kind of journey that we've all seen in the last 2 years, I'm joined now by Dr. Chandrakant Lahariya. He's an epidemiologist and vaccinologist, a public health and policy expert. Dr. Shashank Joshi, member of the Maharashtra Covid-19 task force, is also with us on the show. And I'm also speaking with Dr. Gangakhedkar, former head of epidemiology and communicable diseases in the ICMR. All of you have been, in a sense, fellow travelers through our own journey, through my journey of covering the COVID-19 pandemic over the last 2 years. We hope that we are not in a situation where we have to cover it as intensely as before, because there shouldn't be another wave. But having said that, let me begin with my first question to Dr. Shashank Joshi. Are we truly at the end? We've had an order from the Ministry of Home Affairs effectively ending all COVID-19 restrictions. Are we safe to say that we can go back as close as possible to the world before 24th March of 2020?
Amana, that's a tough question, but I think we are almost there. The third wave is clearly over as far as India is concerned. India currently, for the next 3 to 6 months, unless and until there is a new variant of concern, appears to be sitting pretty tight and good. With a large vaccination coverage to 182 crore population and a very large exposure to multiple strains in first, second and third wave, I think we are almost there. Of course, we can't be complacent. The order clearly states that we must continue following certain restrictions which are necessary in closed indoor environments. But barring that, I think the worst is over probably. And the likelihood and the probability of a new wave is low unless and until a new variant of concern, which is more sinister than Delta, emerges.
Dr. Chandrakant Lahariya, I want your view on ending these restrictions, because we've taken our time and we've played it safe because of large populations, densely populated cities, etc. What about masks? Because the new guidelines say that we need to continue with masking and social distancing. But look around you, people have also abandoned that because it was never a comfortable thing. So the masks have come off, and local administrations have been a little easy about it since the case flow is low. Is it safe to be unmasked right now?
So what we need to remember that these COVID-related restrictions were in place because there was a virus around us and people were susceptible. But definitely after a certain point of time, all of these restrictions need to be removed. The question is that when those restrictions should have been removed. Now, what we need to remember that 2 years into the pandemic, a large proportion of population is protected from severe disease, either after the natural infection or vaccination. So definitely the restrictions which have been in the place need to be eased out, and that's what government had done. The two restrictions which have not been completely removed is a physical distancing from the public place or face mask. What we need to remember that face masks are a proven tool in cutting down the transmission from SARS-CoV-2. But then they are useful when the transmission is going on. What we know currently in India, the rate of daily new COVID-19 cases around 1,500 in a day, which is comes around 1 to 2 million new daily COVID-19 cases, 1 to 2 new COVID-19 cases per million population. So this is really low transmission. So the benefit of mask is really limited. At that point of time, I would suggest that we need to start having a dialogue that at what point of time India would remove the mask mandate. In my opinion, we are at the point where the mask mandate for healthy adults in 18 to 59 can be removed. Possibly for everyone, mask mandate in outdoor space can be removed. Similarly, we know that children are at the low risk of severe outcome. We also know through Sero survey that children have already been exposed and protected. And that's why we can first remove the mask mandate for all children, all school-going children. 0 to 17 years, mask mandate probably can be removed. For adults, mask mandate in outdoor sports can be removed. For other population, indoor space, we can wait and watch for some more time. What we should also advise that even if mask mandates are being removed, anyone who is willing and want voluntarily can wear masks. So that kind of dialogue is required. And I personally think, and there are different other people also think that this is the time that we should start easing out mask mandate in a graded manner, not the complete removal for everyone.
Yeah. Dr. Gangakhedkar, your views on the mask mandate. Can we at least stop wearing masks when we're driving alone in our own car? Because that has been one of the most controversial sort of orders, that the world is now maskless, but if you are driving your vehicle without a mask, you are more likely to be fined. Can at least that end now in a policy perspective?
Yeah, I thought that was relaxed, is it not? Because I think that's a given. If I'm alone in my own car, where is the issue of wearing the mask? So I just don't see why such a regulation should exist. But I thought in some of the states they have already stopped this.
No, so it's not clear. Some states have taken that decision, some states have not taken that decision, but there is no clarity out there, so there's always a fear that you could be fined. But the bigger question, Dr. Gangakhedkar, is do you think it's time that we can ease restrictions on masking?
I would be less comfortable answering that question. No, we shouldn't pronounce that mask can be given away. Because what we have seen in other countries, especially the Western countries, wherever they said no mask as a policy, suddenly you found that even the most vulnerable people, the older people, they also started coming out without masks. And they exposed themselves to the infection, whether they were vaccinated, they were not vaccinated is another issue. Now, perhaps that's one of the reasons why you find in the European bloc, even in US, wherever they try to tweak with that, even no mask kind of a policy, it went just the other way. What I would say is we have played it really well. We have a balanced approach. We just say that you use mask. People will continue to remain guarded to some extent and may not acquire. See, basically, though we believe Omicron is gone, can any of us say it's gone 100%? We still don't know. Because it is a milder infection, because it has only symptoms which appear as if they are of common cold, people may not come forward and test themselves. Why would they waste their time in getting themselves tested if they perceive that the threat of this infection in terms of severity and outcomes is likely to be lower? Perhaps that has to be taken into account. So I believe I will never say that no mask as of now. We have to continue to say, please use mask because that's an abundant precaution. Otherwise, people will not follow it.
Dr. Joshi, we're still waiting for restrictions to officially ease in Maharashtra after the MHA guidelines. Is that a matter of sooner rather than later?
I think it's a matter of time. I think I agree with Dr. Gangakhedkar and Dr. Lahariya that masking needs to be prudent. And India has a very high population density. We tend to crowd, we tend to have closed spaces, we tend to have poorly ventilated environments where there could be a risk of viral transmission. And because the current Omicron is a nose and throat COVID and not a lung COVID, the likelihood of transmission still exists. So we should not, though we are sitting pretty for the next 3 to 6 months, a total complacent approach may not be appropriate. Outdoor masking from the science perspective appears to be okay, that could be looking at a restriction waiver. But these things have to be done very slowly, very gradually. Our biggest problem is we are all or none. So, suddenly it appears to people at large that COVID is over. But look at, South Korea, China, various other countries from Asia as well as from Europe. Wherever the masking has been removed, you are seeing outbreaks happening again. So I think we need to be appropriate and correct. If there is a crowd, if there is a closed space, if there is a poorly ventilated space, I think it is prudent to mask in for your own safety. And particularly, as Chandrakant said, if you are in a vulnerable age group, above 60, now it is difficult for people to have, segregatory or differential approaches in India for implementation. And which is why Dr. Gangakhedkar said that currently it is not yet prime time, but it's just going to be a matter of time. But I think,
For example, Dr. Joshi,
economic and educational activities are reasonable.
You need clarity and regulation. For example, should children in school still go and sit in their classrooms with masks on? It's difficult beyond a point, especially for younger children. So we need some clarity and regulations of where this could ease. The guidelines that have come out so far are quite vague, and then every state will, go ahead and do their thing, and then it's a matter of implementation. Outside the large cities, it's anyway been a free-for-all.
I agree with you, and I think it's just a matter of time that you will see a lot of these changes coming in a graded way week after week.
Yeah. Let me come now to whether it's too early to celebrate and really heave a sigh of relief. We're already seeing spike in cases in one province in China, in South Korea, as Dr. Joshi mentioned, parts of Europe, in the UK. Dr. Gangakhedkar, are you worried that India could now see another wave? Do we have a little bit of lead time, or is it just impossible to predict at this point?
No, I wouldn't say that I am worried, but I would be concerned. The reason is, if you look at the surge, it is also classically showing that it is Omicron that is invading them. If you look at the variant is BA.2. This variant actually had a massive wave even in India. So we are already exposed to this variant. We also have a good vaccine coverage as if we look at it right now. Now, given these things, I wouldn't become concerned, but I would keep my eyes far more focused. Now, where should I be focusing? I have my own kind of thoughts on the same. Now, would I be worried about, let's say, Germany or Italy or UK, or for that matter, Vietnam and Hong Kong? Perhaps I would not be, because these are small countries, and in those small countries, the vulnerable population is also going, size of that population is also going to be small. But I would be extremely worried about how China would be handling, because basically there were 3 countries which had followed zero COVID transmission strategy. So there is hardly any exposure to natural infection in China. And given that, you look at the vaccine that they have given, that this vaccine is akin to the vaccine which is inactivated vaccine, but in Covaxin, they have used a very good adjuvant compared to the vaccine that was used in China. The result is immunogenicity of that vaccine is also low, size of the vulnerable population is low, and they are continuing to follow a path of zero COVID transmission, which has been consistently shown across in the world, including in South Korea. You find that has failed. So to me, I would wait for about a month's time to understand whether my concern can transmit into development of different strategies to just think, how would I prevent this infection from entering in my country? Because I believe if it goes out of hand in China, there would be always a risk that a new variant may emerge if it goes out of hand. But
China is the situation we have to watch. Dr. Lahariya, let me just take a look at how, say, UK, for example, is handling this. And we always take the UK parallel because they have the same vaccine that is primarily used as us. They are going in for the fourth dose in a lot of cases, and additional booster shots for those above a certain age. We have still not vaccinated kids. Our booster doses have started for senior citizens, but it's going fairly slow because people are now feeling there's nothing too much to worry about. Do we need to ramp it up on booster doses, or are we okay for now?
So the entire world and most people are divided into two groups. One which believes in the booster dosage, other group which believes in the body's immune system also. So I'm one of those people who believe that we, after 2 shots of vaccine, we should trust our immune system. So what has happened in other countries is very different than what happened in India, because each of the COVID-19 vaccine is different from other vaccine. It matters a lot whether individual receive vaccine after natural infection or before natural infection, or it also matters which vaccine was administered. So in case of India, we know that second wave had a high seropositivity. Like after second wave, 70% population had developed seropositivity. That's the estimate. Then we have administered 95% of adult population with 1 shot. Omicron wave happened in January, February, a few weeks ago, and which resulted in the additional protection. We know after natural infection, person is protected at least for 3 months, most likely for 6 months or longer. So that's why Indian population is protected. What we also need to remember that majority of other countries, European countries, started vaccination long ago, and then there is a long gap between they received 2 shots and then they are due for booster. In India, the COVID-19 vaccination, especially second shots, have been administered toward the second half of 2021. So still there is some time before they would be due for booster. Putting all of these things together, I would say that we definitely in India, this is a respiratory illness. COVID-19 is a respiratory illness. People might require booster, but we are not in the rush to administer booster for healthy adult population. For those higher age group or vulnerable age group, elderly, frontline worker and healthcare staff, they are already receiving precaution shots and booster. So I would say I'm not one of those who would recommend booster shot for healthy adult in 18 to 60 years, and also for the children, because we know through various sero survey data that children have already developed infection and they have not developed severe disease, so they are in a way protected. And then within children also, the most vulnerable in 12 to 17 years are already receiving vaccines. So putting all of these together, we should have a patience, we should trust our immune system, and we know that 2 shots of COVID-19 vaccines keep providing protection against severe disease and hospitalization for fairly long. And by the time we will have more evidence, we can go for that.
Dr. Joshi, your inputs on the question of do we need to now push the accelerator again on the vaccination program? The primary goal seemed to have been to cover majority of adults with at least 1 dose. We seem to have done that, and then it's sort of slid. The pressure has eased on the vaccination program. Is it time to accelerate again? Or are you in the camp, as Dr. Lahariya describes, of people who think that after this Omicron wave, we need to trust our own immunity?
So, Tamanna, I would be very clear on my answer. First of all, the global pandemic will only end when the world is vaccinated. And I think it is important to identify all the people who have not got a single dose of the vaccine and get them and motivate them, if they are eligible, voluntarily ensure that they are getting their vaccine up there. Secondly, people who have received their first dose but not received their second dose, encourage them to get their second dose. And also people now have developed hybrid immunity. Vaccination program is the public health policies, most of the people, most of the time. So I think what is being said is that we have had a large exposure both to pediatric and adult population in India in Delta wave and in the Omicron wave. And because of which there is some degree of natural immunity, there is some degree of vaccine-induced immunity, and wherever the government of India has recommended precautionary doses, we should encourage them. So I think voluntary encouragement, information, education, counseling is the need of the hour. And yes, whoever is eligible and whoever is willing to get vaccinated should be vaccinated. Remember, when we vaccinate the world, we will be in a better position to save lives and save severe disease. That's really the idea of immunity. Basically, these are immune boosting. They may not prevent infection. They may not be able to prevent disease, but the disease will be milder and the complications will be lesser in most of the people. That is what is the basic theme. So I think we should encourage that, but we should not push very hard that we need multiple boosters. Remember what has happened in Israel. They have given multiple boosters. They are talking of a 4th booster now in US and Israel, but their infections are still there. They are a different platform. That mRNA platform, probably lasting immunity is only for 2 or 3 months. So we do not know. The vaccine research and the evidence based on vaccine is still emerging. So we have a long way to go in this direction. But one thing is very clear cut, that at least having 2 doses on board for most of the people, or as many people as possible who are eligible, is the need of the hour, at least in the adult world.
Yep, at least get that one vaccine, trust our immunity. And maybe looking back, we've had some really tough times in these last 2 years. We've had mass migration after the first lockdown. We've had a devastating second wave where many lives were lost. Our healthcare system was tested and pushed, lack of oxygen, etc. We've been through that nightmare. We hope we never visit again. That situation is never visited or repeated again, and that we have emerged stronger, wiser, and perhaps with a more robust healthcare infrastructure. That's all we can hope for at this point. Thank you so much to all of you for joining us.